Hi, fellow classmates and professor. This is Stacy Williams, and I'd like to go for a patient that we saw recently in our office. MB is a single white 47-year-old female born on 4/20/1973. She presents to the office today by herself, appears to be a dependable historian. She has health insurance, and she is here to establish care for the first time. Patient states, I need an annual physical, lab work, and I have wounds all over. HPI, Miss NB is a 47-year-old single white female who presents to the office today by herself. She is here today to establish care and recently moved from Detroit to start a new job as a medical assistant. She states that she last saw her primary care physician a year ago but needs to have an annual physical, lab work, and she also has a disease called benign chronic pemphigus, which causes her to have a rash that itches, and then she has open areas all over her body due to the scratching. She states that she was diagnosed with benign chronic pemphigus as a child, and it has been several years since it has bothered her. She states the flare-up started about 2 weeks ago and just can't take it anymore. She is unsure that she could, what the triggers could have been. It is painful, 9 out of 10. She takes Tylenol to help relieve the pain, but it doesn't help. It only brings it down to a 7 out of 10. And she has also tried hydrocortisone and calamine lotion to help with the itching and the rash. She states that the wounds would drain a yellowish color, which itched but no odor. She reports on today's visit that the pain has diminished to a 4 out of 10 because the areas are drying out slowly. Review of symptoms. General, she declines any changes in weight, fever, loss of appetite, chills, or weakness. Eyes, she rebuffs any changes in vision, redness, pain, or blurred vision. She does wear corrective lenses for reading only. Ears, nose, and throat. She rebuffs any changes in hearing, no tinnitus, no or discharge. Reports no nasal issues such as sinus congestion, pain, or epistaxis. She doesn't have any pain in her throat, any hoarseness or difficulty swallowing. She states she doesn't have any problems chewing, any bleeding gums or cavities. Cardiovascular, she rebuffs any chest pain, palpitations, angina, or murmurs. Pulmonary respiratory, she states that she doesn't have any history of asthma, respiratory issues, or shortness of breath. GI, she reports that she has daily bowel movements, no blood in stool, diarrhea, constipation, and no changes in appetite. GU, she reports no urinary issues or discomfort, states urine is light yellow in color. Integumentary, she reports a rash under her arms, her groin area, and under her breast, and now has open areas that are drying out. She reports that she has pain at each open site, but nowhere else. She states that the areas are scaly, very itchy, and burns at times. Musculoskeletal, she rebuffs any pain in her muscles or joints. Neuro, she reports no headaches, weakness, nausea, numbness, or vomiting. Lymph, she rebuffs any lymphadenopathy. Psych, she reports no feeling of depression, no suicidal ideations, anxiety, or exposure to violence. Allergy and immunology, she does not have any. She reports no allergies to any drugs, any foods, any occupational or environmental allergens, and no allergies to pets as well. Past medical history. Medical problems are hypothyroidism and the benign chronic pemphigus. Denies any hospitalization or surgical history. Preventative care. She saw the ophthalmologist May 2020, dentist January 2021. Physical, she had done March 2020. Labs, March 2020, and her last pap smear was in April 2020, which was negative. Medications that she's on is levothyroxine, 88 micrograms, 1 tab by mouth daily before all meals and foods. Vaccinations, all childhood vaccinations are up to date, but she refuses any flu shots, pneumonia shots, and definitely doesn't want the COVID shot or vaccine. Family history, her mother is alive, 74 years old, and she does have the Haley disease. Her dad, she doesn't know him. Her maternal grandparents, maternal grandmother died at age 90 and has a history of hypertension, hyperlipidemia, and benign chronic pemphigus as well. And maternal grandfather died at age 82 from unknown reasons. Paternal grandparents, she doesn't know them. Siblings, she states she's the only child that she does know of because she doesn't know her father. Social history. Occupation, medical assistant. Sexual history and contraception protection. She's currently not sexually active, but when she does have intercourse, she does use protection. She's not on birth control. Her hobbies are reading and watching her favorite shows. Chemical history. She reports she doesn't drink alcohol, doesn't smoke cigarettes or marijuana, and she doesn't use any illicit drugs. Marital history. She's single, no children. Living arrangement. She lives at home. She lives alone in an apartment. Exercise and diet. She reports she goes to the gym twice a week and walks on the other days for about an hour at a time. She eats pretty healthy, not a lot of meat, and doesn't consume any caffeine except for 1 cup of coffee in the mornings. And she drinks about 5 to 6 bottles of water daily. She states she sleeps well 5 to 6 hours at night. She does go to church, and she does have a good support system with the church and her mother. She does drive safely. She wears her seatbelt. She doesn't text and drive. She doesn't drink and drive because she doesn't drink alcohol. And she does protect her skin when she goes out in the sun as much as she can. Vital signs: blood pressure reveals 124/70, heart rate 70, temperature 98.2, respiration 16, O2 sat is 99%. Pain is 4 out of 10. She's 68 inches, 140 pounds. Her BMI is 21.3, so she's fine. Physical exam, general. NB is a well-groomed, well-nourished, and healthy female who maintained good eye contact throughout the assessment and interview. HENT examination are remarkable with no noted deficits. Neck, her neck is supple, no swelling or scars, and no cervical lymphadenopathy. Mouth, no cavities, no bleeding gums. Palate and gums are pink in color, and no erythema to posterior pharynx. Her cardiovascular S1 and S2 sounds auscultated, no irregular heart rhythms. All 4 extremities are pink in color with no noted edema, cyanosis, or clubbing. Pedal pulse is bilaterally or 2+. Respiratory. Upon auscultation, lungs are clear bilaterally, thorax is symmetrical, and breathing is even and unlabored. Lymph nodes, no lymphadenopathy. Integumentary. She has a light rash under her arms, groin, and under her breast, and there are multiple areas that are healing with no drainage. Skin color is evenly distributed in all other areas of the body. Her skin is warm and dry to the touch, and she has good skin turgor. Neurologic, she is alert and oriented ×3, ambulates well, and communicates well without any difficulty. Musculoskeletal, she has a negative SLR. Her strength are 5 out of 5 to bilateral and lower extremities. Assessment. We're ruling out shingles as evidenced by blisters, rash, pain, and draining blisters. We're ruling out, number 2, ruling out atopic dermatitis as evidenced by draining blisters, rash, redness to areas, and itching. And number 3, we're ruling out benign chronic pemphigus as evidenced by rash, draining blisters, itching, family and medical history, and pain, also due to areas that appear scaly, very itchy, and burning. So the definitive diagnosis is benign chronic pemphigus, also known as Hailey-Hailey disease. The plan. Diagnostics, head-to-toe assessment, medical history, family history, clinical evaluation. We will do a biopsy of the affected areas to assess and confirm that this is benign chronic pemphigus. Blood work are done, such as CBC, CMP, and a culture of the open areas to determine if there's any infection or any other infection processes that are occurring. Annual labs were drawn because she hasn't seen the doctor. She does have hypothyroidism, so we will check her thyroid hormones, the lipid panel, and urinalysis and culture. Assess for autoimmune disease by ordering labs such as CRP, ESR, and ANA. Assess for white lines running lengthwise of her nails because that could be a diagnosis of benign chronic pemphigus. Molecular genetic testing is checked for mutations in the ATP2C1 gene, and this can help confirm the diagnosis. Treatment is based upon symptomatology. So if whatever is occurring with her right now, she has some itching, and that is caused by her by the rash, but it's slowly going away. So we prescribe hydrocortisone 10 cream to apply to the itchy areas twice daily as needed for itching. We ordered 1 tube and 1 refill. We prescribed nystatin cream to be applied to open draining areas twice daily and as needed to prevent infections. 1 tube, we prescribed 1 tube with 1 refill. We also prescribed for her to take ibuprofen, 600 milligrams, 1 to 2 tabs every 6 to 8 hours as needed for pain. And we gave her 30 tabs with 1 refill. We instructed her to avoid specific triggers such as the sun, excessive heat and sweating, and friction, and to keep all open draining areas covered and dry. We referred her to for genetic counseling for support for this disease because it can take a toll on somebody and affect their body image. Right now she doesn't have that, and we hope she doesn't. We refer to a dermatologist for biopsy of the lesions to rule out any form of skin cancer because, again, we don't know if there's anything more involved in this situation. Education. Instruct on wearing sunscreen when outside. Instruct not to go out in the sun in the 12 to 2 hours because that's when the sun is at its highest peak or it's the hottest. And we want her to wear loose-fitting clothing to avoid friction. Instruct on therapies that are trial therapies that are going on. They have the Guard Foundation that can help with that. We also refer to a specialist who are proficient in treating this disease. So if none of these treatments that we gave her helps, that we can refer her for further care. We are going to follow up with her in 4 weeks. We want to see if the nystatin cream is working. We want to make sure she's not getting any infections. We want to follow up on her lab work that we drew. We are ruling out for autoimmune disease. And we want to see if she still has pain or any further breakouts. We did instruct her if she starts breaking out again, it gets worse, that she can go to the emergency room. Or if it's the daytime, she can definitely give us a call and come into the office and we can take a look. References are benign chronic pemphigus, 2021, National Organization for Rare Disorders, NORD, and familial benign pemphigus, August 20th, 2020, Medscape. And thank you. Have a great evening. I hope you guys enjoyed my presentation.